Good morning, everyone. Thank you for joining us here today. Welcome to the National Mental Health Innovation Showcase with Mental Health Reform. My name is Shauna Bowers, your MC for today's event, and it's my pleasure to guide you through this exciting showcase of innovation in the mental health sector. In my role as health correspondent of the Irish Times, I see regularly the need for innovative thinking programmes across the mental health sector. It is a growing area that we need to focus more on. Firstly, I want to welcome you all to this important event. We have various representatives here from the private, public, and VCS sectors. And it is important that you all made time to be here and to see what important, innovative work is happening across the country. Let's kick off the day with energy and enthusiasm as we explore some groundbreaking initiatives and engage with some leading experts. Our first speaker needs no introduction, but I'll give her one anyway. Please join me in welcoming Fiona Coyle, Chief Executive of Mental Health Reform, to deliver the opening address.
Thanks so much. Can you hear me okay? Yeah, it's on. Okay, good. Good morning, everyone, and welcome to our conference today on inclusive innovation. And it's a real privilege to stand here and look around the room at such a diverse audience, which is exactly what today is about. So we've really strong representation from our own member organisations here at Mental Health Reform. I can see a few faces from the private sector, from colleagues in the HSE, from the department, and I think that speaks to today, which is about really, bringing people together to see how we can do things better in the mental health sector. The mental health challenges that we face as a country, I'm preaching to people who know much better than me, who are facing it at the front lines day on day. But we know, the often too familiar story that needs are increasing. More and more people are, looking for help, and we've spent so long telling them to take that first step. Then they're put on waiting lists. They're left waiting far too long. In particular, we hear, the case of young people who simply are just not able to access services. But then on the other side, we have, staffing issues. We've recruitment issues. We currently have an embargo on staffing in the HSE. And these are all very complex challenges that we have to address. And I suppose the overall kind of thread of where mental health has come from is that it is an underinvested area of our health system historically. So our base is very low to begin with, and the challenges that we're facing in this country broadly around health and health spending, unfortunately, is impacting, mental health even more so. But to move forward and to address these challenges, we need contributions from all segments of our healthcare sector. So the public, of course, the community and voluntary sector, which we'll focus on today, and also the private sector. Business as usual, it's not an option. For mental health reform, it's not about doing what we're currently doing and keeping ticking along. We really need to challenge ourselves to find new ways for addressing these challenges within this ever-changing context. We do a lot of analysis and reflection with our members on, how can we leverage the strengths of all these different sectors, different segments, to tackle the significant capacity issues and other challenges that are really impeding the development of the Irish mental health care system. And one example of how we're trying to do that is through our Brave New Connections project. And I suppose that's part of the reason why we're all here today. This project has been supported by the generous funding from the Community Foundation Ireland. I'd like to really thank them for investing into this important work. This work began just, I suppose, as the pandemic emerged. and built on work that mental health reform had been doing through a European funded project on e-mental health, on digital mental health and innovation. So, pre-2020, we were trying to look at how in Ireland we could introduce concepts around e-mental health. And in 2020, that all changed dramatically, but we were able to leverage the work that we'd done, the contacts that was across European project, the contacts that we built up, because our European peers are much further along on that journey than we are. And the Brave New Connection project enabled us to capture the sector's experience and support capacity building for our members as they adapted and responded to the challenges and disruptions of the pandemic. And for many of our members, it was a real pivotal moment, and they were looking at delivering services in new ways, looking at technology, and they haven't looked back. And you'll see as we go through the presentations, there's such innovation that is happening in the community and voluntary sector. The Brave New Connections project has also facilitated mental health reform to publish a number of key pieces of research into the sector, into our experience with COVID, and also capturing some of those really concrete innovations that are happening. But before we delve into that, I suppose I thought when I was reflecting on today and reflecting on the word innovation, innovation is something that can mean different things to different people. So I thought it might be good at the start just to reflect a little bit around what exactly is innovation from a mental health reform perspective. And for us, innovation is about really translating new ideas, and they can be adapted ideas, they can be ideas that have been tweaked, but looking at something new and adapting them into tangible, impactful solutions. So it's more than just technology. It's about rethinking our processes, our approach, and strategies to meet evolving needs. It's about being proactive rather than reactive, anticipating future challenges, however difficult that may be, and developing creative solutions to address them. And at the heart of all of this for mental health reform is engaging with and listening to those who have first-hand experiences of using the services. Because we can be as innovative as we want, but if we are not listening to those who are accessing the services and meeting their needs, our innovation is in waste. And I think in the context of mental health in particular, what innovation means, it's about finding better ways to support people, individuals, communities, to enhance services and to improve outcomes. That's really important. It's about giving people the support that they need and looking at how best we do that. And often, when we talk about innovation, we automatically look at tech and think about AI and how AI could do a lot of the work we're doing and do it faster and more cost effective. And yes, technology is achieving things today that some of us could never imagine. I grew up in a house where we didn't have a phone, I think, until I was 15, so to think about today that I couldn't be without my phone, it's my connection to the world. If someone would have told me that back then, I would have laughed. I would have seen it impossible. Self-driving cars, technology has brought us so far. But the use of digital mental health technologies for mental health in particular, we can't not acknowledge the benefits that they bring, including, there's increased flexibility and the potential for, reaching kind of cross-geographic boundaries, meeting people in their own communities. However, we must ensure that at the core of all these discussions and when we're looking at digitalisation, that we look at the issue of digital inclusion. So this refers to activities necessary to ensure that all individuals and all communities have access to and use information and communication technologies, because that simply isn't the reality we live here in Ireland. You know, for lots of us, and we're very privileged, you know, we have our phones, we have our data packages, you know, we have safe spaces maybe to take calls. That's not the truth for everyone, and we always need to recognise that, because again, if we move forward in an innovative path, we leave a huge cohort of individuals behind. We're not actually achieving change and addressing those challenges that I've already outlined. I do want to flag a piece of work we did in this regard last year. Mental Health Reform and the HSE Mental Health and Engagement and Recovery Office unveiled a really kind of, I suppose, unique report on digital inclusion and access to mental health services. This, you know, report really looks at, you know, some of the challenges that are there that need to be addressed, but also looks at opportunities. Digital advancements, as well, as we have heard very recently in the media, can also have negative impact on mental health, and in particular, you know, there's a huge conversation happening around youth mental health and social media and mental health reform. You know, we continue to engage in the policy discussions in these areas. We are very aware, you know, that digital and innovation is not in itself an answer to everything, that we need to bring. We need to bring all the different sectors together, because change cannot, and we've seen it time and time again, change cannot be achieved by one group and one sector alone, but we need to create those spaces for all the different sectors who are working on different components of our system to come together and to really understand each other and to see what each other can bring to the table. And that's part of what we're trying to do here today, is take that time to see what's happening, to hear from different stakeholders, from different actors, and to see how we can move forward for the benefit of the mental health sector overall. I want to take us through a few slides just to set the scene for today, if this works. First of all, I just wanted to outline that, as with any conversations around mental health, it may be triggering or upsetting for some people, but just to, if you need to, there's you know, quiet area down at the end if you need to step outside, and there's also a lot of support available. So here are some of the websites, including the Samaritans, or text 50808 to have a text conversation. So our sector, so mental health reform, for those who aren't familiar, we are a coalition of over 80 organisations, many of whom are community and voluntary organisations, delivering mental health and supports. As you know, in Ireland, we have a very unique health system in the fact that our government is very reliant on the community and voluntary sector for the delivery of health and social care services. In disability services, for example, 40% of disability services are delivered by the community and voluntary sector. We don't have that type of data yet around the mental health sector, because we're a relatively young sector in comparison, but we do know that our members, the community and voluntary sector in mental health, they make a significant contribution in supporting the state in the provision of services for people with mental health difficulties. So this is part of our Brave New Connections report that we did in 2022 now, that for the first time try to capture the depth and diversity of the services and supports being delivered by mental health reform members. And as part of that report, for the first time ever, we actually were able to put together indicative volumes of services being provided. Now, these figures are based on 2019 because they were the most recent figures at the time. So that comes with an asterisk. They're probably much higher after the pandemic. But in 2019, there were over 870,000 helpline and crisis contact calls. There were nearly 250,000 counselling and psychotherapy sessions delivered by mental health reform members, and 130,000 were reached with psychoeducation and self-help supports, and 90,000 were reached by peer support, advocacy, recovery, social inclusion and other programmes. They're really significant figures, you know, for a country of our size and our population. So they're kind of some of the areas just in a different way of what's being created. And then, you know, as part of our second piece of analysis that we did this year, we went back. So, you know, 2023, 3 years since the pandemic, where are organisations at when they reflected back? So a significant amount, 90% of organisations reported at least some change or development over the past few years. You can see here, and you'll hear real-life examples of all of these over the course of this morning, on how organisations really incorporated digital or innovative approaches into their models of care and into their service delivery. It really enabled people to reach new groups, to break down geographic barriers, and to increase overall volumes. There's a lot of innovation, and we could be here all day and into tomorrow if we were to go through each example that came up through our research. But you will hear some really insightful and interesting presentations. But you can see here, and you know, this will be available on our website at some stage, some of the work that our member organisations have been doing, how they've been utilising new technologies, utilising new ways of working to deliver services to a diverse range of groups. And some of these groups in particular, you know, when you think about the deaf and hard of hearing, this is a group whom have been really saying that they haven't been able to access services and support, and technology and organisations working with them through those new technology. I guess, you know, there's amazing work happening, but there's huge potential, and I suppose that's what today is about as well. There's huge potential within the community and voluntary sector. We know that our secondary mental health services are under great stress, and we also know that people need support at the earliest possible juncture. And that support is being given at the moment through the community and voluntary sector. And a lot of what, you know, you'll hear me talking about at every opportunity I can is we need to invest in the community and voluntary sector delivering mental health services and supports. We haven't seen an increase in 5 years. In fact, this year, not only has the money stagnated, but it's too early to tell, but it's almost decreased this year for some of our member organisations. But you know, you can see here, like, there's so much that is happening, and with the right investment, with the right collaboration, we as a sector can deliver even more. We are there in the communities. We understand the needs of those communities. We can furrow pathways for organisations, for the HSE, for departments to really understand and listen to those accessing services and to see what they need. But our members have done a lot of that already and have trialled and tested out a lot of innovative processes, but they just need to be invested in and scaled up. But we need everyone around that table. Going back to my opening point, this is just not about, well, our sector does this and you do that, and you know, we're over here doing this. We need to bring everyone together, because unless we're all working collaboratively, we're going to miss something. And what the impact of that will be is that our services are not going to have the impact that they need to have for those who need to access them. So yeah, I'm delighted to see such a packed house here today, and really want to thank our member organisations for believing in this project, for filling in a lot of very long surveys, for coming with us with their innovations. This project would not have been possible without them and our own innovation team in mental health reform. So yeah, just to enjoy today, to talk to each other, to network, to exchange cards, and I hope that this will be the beginning of conversations that we can have as a sector. Yeah, really looking forward to hearing from all the presentations. Gurmila Maiguf.